Hello, my name is Ron Rogge, and I'm a professor of clinical psychology at the University of Rochester. I'm going to be showing results from data I collected with a student, AJ Pollard, during the first 6 months of the pandemic. Now, COVID-19 really dominated the national news media here in the United States starting around March 16th, when the president gave his first national press briefing. Within 11 days, half the country was in lockdown, and the vast majority of schools and colleges were closed to in-person instruction. Given the higher mortality rate with COVID-19, people were stressed about their own health and the health of their loved ones. And given the social distancing and lockdown efforts, they were dealing with social isolation and cabin fever like never before. As sexual health has been robustly linked to relationship health and individual well-being, because sex rocks, we wanted to look at sexual health as a source of resilience during the pandemic. We did this within the context of the enduring vulnerability stress adaptation model. It's a mouthful, easy for me to say. We thought that stressful events would shape sexual health across time, which would in turn shape relationship health, which would in turn shape individual health. So we saw sexual health and relationship health as a sets of dynamic processes linking COVID stress to individual well-being, which meant that they had the ability to either buffer those links or exacerbate them. To test this, we did an online study with a baseline assessment and 6 monthly follow-ups. We recruited over 1,200 sexually active adults in romantic relationships between March 5th and May 5th, right at the beginning of the pandemic, and 60% of them gave us follow-up. We measured multiple aspects of each of the key variables in our model, and we used multi-level modeling to distinguish from stable between-person differences across the 6 months of the study from within-person change across time. At the level of stable between-person differences, these are the paths that emerge as statistically robustly significant. It's a lot, I know, I'm going to take you through it. So stable levels of COVID stress in blue were predictive of stably lower sexual health in green, lower relationship health in yellow, and lower individual well-being in red. With the exception of one path, stable levels of COVID-related health stress across the 6 months predicted stably higher levels of communicating affection to the people you love the most, a nice adaptive path in our model. We also got indirect paths that were supportive of our model. So higher stable levels of health stress across the 6 months were predictive of greater orgasm difficulties across those 6 months, which predicted more irritability across the 6 months, and greater depressive symptoms across the 6 months. And the cool thing is stable sexual satisfaction across those 6 months emerged as a source of resilience. It wasn't predicted by COVID stress, and instead it predicted greater relationship well-being and individual well-being across those 6 months. At the level of within-person change across time, these are the paths that came out as significant. Spikes in cabin fever predicted corresponding drops in sexual health, relationship health, and individual well-being. And we got indirect paths where spikes in cabin fever impacted sexual health, which impacted relationship health, which impacted outcomes within the same wave. So we found support for sexual health as a potential source of resilience or risk during a pandemic. Thank you.